I'd like to welcome you all to RePicture and our panel discussion on human health. So this panel is part of our Summer STEM Career Accelerator, and unlike our regular sessions, they're open to the public. So for our panelists who are joining us today and others joining us today, I'll share a very quick introduction to RePicture and our program, and then I'll introduce the panelists and turn it over to Jerry, who will be moderating our discussion. So a really quick overview for just a little bit of context. RePicture is a mission-driven public benefit organization. Our vision is a world where everyone can thrive in STEM, and we're building a new way for you to explore careers through the world of STEM all around you. So this panel is part of our flagship 6-week-long summer program. And in the program, we focus on 3 core pillars: professional skills workshops, mentorship, and project portfolios. So for professional skills, we focus on closing the gap between school and career and cover all those critical skills you need in the workplace, like STEM writing and communication, working on teams, preparing and giving presentations, and more. And we also provide our students with opportunities to connect with a wide range of STEM professionals. And that's what this panel discussion is all about. And as well as mentors who come and talk on our career panels, are interviewed by our students about their projects and their work and more. And throughout, the students are learning actively by researching and publishing articles about real-world STEM projects in their field of interest. And through this, they create this unique online portfolio of project research that they can showcase, all those professional skills we're practicing, as well as their talents and passions. So it's a way for them to stand out. And for those companies hiring, it's a way to identify and connect with those really motivated students who are genuinely interested in the work that they do. So finally, while our students are building their own portfolio of project research, they're helping others learn about STEM as well. So we've had well over 1,000 projects uploaded to RePicture, and you can now go to our platform to see what kinds of actual projects you might work on with that biology degree or engineering degree. And so our students are helping us build a new way to explore careers. Today is one of 4 panel discussions we'll have this summer, and this is the first of the summer, so we're kicking it off today. You can find all of our past panels on our YouTube channel on a wide range of topics, including robotics, semiconductors, green energy, and more. So these panel discussions are a great resource, not only for our students that are joining us today, but for students everywhere after today. And with that, I would like to welcome our human health panelists, and I will introduce them, each of them here now. Did Adimika, was she able to join? Do we know? I think so. Okay. So unfortunately, we lost Adimika, but I will introduce her in case she is able to join. Hopefully she got the link. I shared the original invitation, had the incorrect link. So Adimika is a founding director and CEO for health tech for Medicaid. She trained as a clinical epidemiologist and turned into a successful health care administrator. She is a hospital and health system executive who loves to help people better understand health, well-being, and healthcare through storytelling, connection, and culture. She uniquely brings her population health and public hospital expertise and focuses on improving health equity and access to quality care for vulnerable populations. She's a board member, an advocate for women's leadership, and a clearinghouse for connecting people and process. So Adimika has an MPH from the University of Washington and a BS from Clark Atlanta University, and studied at Boston University School of Medicine. So we also have Paola Prieto. She is a Biodesign Innovation Fellow at Stanford Byers Center for Biodesign, and the host of Mio Cardio podcast, the first cardiology podcast in Spanish for Latin America. She is a physician scientist interested in clinical and biomedical research. She's passionate about the application of policy, leadership, and management at the intersection of bioinformatics and medicine. Paola is a director of medicine and master of biomedical engineering from the Universidad de los Andes and studied biomedical informatics and medical engineering at Harvard Medical School. And we have Dr. Stephen Ullmann. Dr. Ullmann is the chair of the Department of Health Management and Policy, as well as the director of the Center for Health Management and Policy at the University of Miami. He's a professor in the Department of Health Management and Policy. He's the author of over 40 monographs, books, book chapters, refereed journal articles, commentaries, and invited articles and abstracts. His expertise has been sought after for interviews, commentaries, and panel discussions by local, national, and global news outlets, including CBS, Fox Business News, CNN, and PBS Nightly Business Reports. So Dr. Ullmann holds a bachelor's degree in economics with distinction from UC Berkeley and a master's and PhD in economics from the University of Michigan, Ann Arbor. So please join me in welcoming Paola and Dr. Ullmann, and hopefully Ademika will join us as well. And with that, I'll turn it over to Jerry, who's going to be our panel moderator today to lead the discussion. So I'm going to stop sharing my screen and turn it over to you.
Okay, can everyone hear me? Thumbs up works, cool, awesome. Well, hi everyone. To get started, I just wanted to ask both of our panelists what you would prefer to be called while I'm asking questions. Do you have any preferences? First name's okay?
First name's great.
Okay, awesome, cool. So first question for today is, can you tell us a story of how you got to where you are today? Such as early education or your first job or something that influenced your direction.
Paola, you want to start?
Absolutely, Steven, thank you. So first of all, thank you everyone for being here and for just making the time to connect with people and just to get to know a little bit more of our work. I can tell you about my story. So I did med school back in Colombia, where I'm originally from. And when I finished med school, I always had it in my mind that I wanted to be a clinician and I wanted to be a cardiologist and I want to practice as a cardiologist. But when I finished, I had to work in very underserved population hospitals. And I realized that there were a lot of unmet needs and a lot of problems in those hospitals that weren't solved. So in my mind, I was like, as a clinician, I cannot make a lot. I can do a portion of all the job that we have to do. But there must be another ways to try to get to more people with the job that I was doing. So I went to my university, Universidad de los Andes in Bogota, and I was like, please teach me something about engineering because I want to develop solutions for the problems that I'm seeing in the hospital. So that's what I did my first master's in bioengineering. And when I finished my master, I was able to implement some of the projects that I was doing in my master's into my medical practice. So that was the first aha moment that I have. I'm like, oh, perhaps the clinicians or the physicians could do something else to try to integrate it in your practice and try to help patients with that. So then I got a job offer from one of the hospitals here at Boston, the Brigham and Women's Hospital that is part of the Harvard hospitals. And when I was working there, I saw all the resources that they had available and all the cool technologies and all of this. And I was like, perhaps I can integrate everything that they have in here back into my population, in my patients, with a better way. So the first thing that I realized is that they had all these databases with the data and everything super well compiled. And I was like, data analytics. So I went to Harvard, I did my master's in bioinformatics to try to integrate everything in one single kind of bucket. But then I was like, I could do a lot of research and that's good. But the bridge and how to just fill the gap between what was published in research and the things that I need to take to my patient in real life, it wasn't still huge. So I found a way to integrate that with innovation. And that's why I came to Stanford to do my fellowship in innovation, to integrate my three paths, bioinformatics, bioengineering, medicine, and to be able to bring those solutions into the clinical setting.
Awesome, thank you for sharing.
So Steve Ullmann here. I was born and raised in San Francisco. I'm first generation college. My parents were refugees. My dad had an 8th grade education. My mom went to secretarial school, basically because they were refugees and trying to do what they could. And when I went to college, I was actually pre-law initially. And as I was sort of exploring college and sort of being a B student and sort of getting by, I took for the third choice of a course one semester, economics, and I immediately fell in love with it. And my grades just started going way up. And I had a advisor mentor who really counseled me well, saying, Steve, I don't want you to do a basic undergraduate major. I want you to take as much economics as you can stomach and as much mathematics as you can stomach. And as a result of that advice, instead of being a person who was like every other graduate in economics, I basically stood out. And whereas I had been pre-law, I was being too much fascinated by economics. And I decided to go to graduate school in economics, having no idea what I would do with it. But by differentiating myself from the crowd, which is what I teach my students to do to this day, I was able to get into some great graduate programs. I ended up going to the University of Michigan, Ann Arbor, which was considered to have the best program for what I was interested in. And that was a field called industrial organization, antitrust, and regulatory theory, which basically mixes law and economics. And when I got there, not knowing how cold Ann Arbor would be, given that I was raised in San Francisco, I'm going to Berkeley. I had a great education there. But here's where life takes you into all kinds of different directions, unbeknownst to you. I went to graduate school to study what I just told you. But in the process, I was your typical poor graduate student. I had no money. My dad had just been laid off. And so I was seeking additional income. And there was a sign on the door in the economics department looking for a grader for my undergraduate intermediate microeconomics course. I can do that. That was my major. So I applied, and the professor looked at my resume and he said, I really like what I see here. I don't want you to be the grader for my microeconomics course. I want you to be the grader for my brand new graduate level healthcare economics course. I said, know nothing about it. Never took the course, undergraduate, much less graduate level. He said, you're going to sit in on the course and grade for me. So I sat in, didn't take it for credit, sat in, and he would drop papers off with me on the way home every evening at 6 o'clock in the evening. I'd grade all night, plus doing my own homework. He'd pick them up at 6 o'clock in the morning on his way to the gym. I'd be pulling all-nighters. And after one semester, he said, Steve, you did really good work. I really liked it. I just got, I'm going to put this in today's dollars, I just got a $25 million grant from the Robert Wood Johnson Foundation, very prestigious, to set up what was called the Health Manpower Policy Studies Group to study how healthcare resources, human resources, went around the country. Would you like to be one of my research assistants? It took me about 3 seconds to say yeah, and later became a research associate, later became affiliated with a consulting firm based in Boston, Policy Analysis Incorporated, which he was a principal in, and worked under literally the founder, one of the major founders of the whole field of healthcare economics, Paul Feldstein. And that opened up all kinds of doors. When I came out of graduate school, I had offers in government, very high-level offers in government, because I was literally one of the very few people working in the field. I had offers to be in high levels of healthcare consulting and also in academics, in academia. And I started at the University of Miami because they had everything I needed and wanted to do my research and my teaching. And plus they flew me down when it was 40 below actual, 96 below wind chill in Michigan. And it was about 70 degrees here in January, and the rest is history. And I've spent my career here extremely happy and being one of the very first people working in the whole field of healthcare economics, which is a very interdisciplinary field. I'm very happy.
Awesome. Thank you both for those answers. And going more into what you all do now, can you give us a brief explanation or of what you do now and how that how what you do now helps people as well?
Thank you, Steven. Absolutely. So basically what I do in like simple terms is I identified unmet clinical needs. So it's a process. We go to the hospital, we talk to patients, with physicians, with nurses, and we kind of like take a notebook and we write down all the problems that they have. Then we come, we start analyze, we do a lot of research in each of them, we apply some filters, and then we select the ones who have like either like great impact or like it has like a lot of problems with the patients, or it can reduce mortality. Well, we have like different filters. We filter them down, we choose one. And for that one, we start like the inventing phase. And what the inventing phase is like, we bring technologies and apply those technologies to that problem, see which one is a good fit for this, for the problem. And then we do all the thing with like the business. So we do business analysis, we do reimbursement analysis, like a lot of things in order for us to bring that technology to the patient's life or to the patient's house or like to the clinic. That's in a nutshell what I do. And how does it help patients? That is your second question. So we create a lot of technologies in my program that have been like 50 medical devices that have been created as a company. And those medical devices, each of them help a lot of people with different either diseases, diagnostics, or treatment.
How do I impact? Well, a number of ways. Let me tell you the teaching part. I've now had well over 20,000 students in my career. So many of them have gone into very high level areas of healthcare management, healthcare policy. I've had a lot of physicians who I've trained to understand how to do beyond patient care to having more population focused care and policy. So that's the teaching part of what I do. The research part of what I do, which is very much a part of my work, and the lecturing I've done. I've traveled literally all over the world. I've done work in Asia, in Europe, all through Latin America, the Caribbean. Just a couple of examples of some of the projects I've worked on, a couple of the more recent ones in terms of impact. I tend to work in interdisciplinary teams. So one of the projects we were working on, for example, was on red tide, which is the harmful algae blooms that affect the Gulf, Mexico and the United States, including the west coast of Florida, and also has impact around the world in other parts of the world. I was working with a team of marine scientists, atmospheric scientists, education experts, geography experts, and myself, and a colleague of mine was the Oceanographic Institute. The marine scientists were trying to figure out what causes the red tide, which causes huge fish kills, kills manatees, kills bird life, causes, and then what happens as it comes onto land and blows onto land, it causes all kinds of atmospheric situations which cause respiratory distress, gastrointestinal distress, and also a huge stench as well in generally upper class neighborhoods as well as lower class neighborhoods. Marine scientists were trying to figure out what caused it. Atmospheric scientists were setting up models for how it gets blown onto land. And then my role, together with a colleague of mine, was to try to figure out, first of all, how it was impacting utilization of healthcare. So we could come up with predictive models saying, uh-oh, here comes red tide. Now we're going to see an increase in utilization of emergency rooms, of hospitals, physician care. We're going to need to resource that. We're going to need to set up pharmaceuticals in the area to deal with that. We're going to have to deal with absenteeism in schools, et cetera. So this is one of the projects we were working with. We had a grant from the NSF, National Science Foundation, a grant to basically look at this. It was over $1 million grant to see if we could, and we did, come up with results associated with that. That's one project. A lot of articles that came out of it, a lot of students who we had both undergraduate and graduate working on projects associated with this, getting their research experience. A project that I'm working on right now, to give you one other example, I'm working with a team of professors and students from the medical school, from the School of Architecture, from the Department of Public Health Sciences. We are looking at the impact of greenery in low-income neighborhoods and how it impacts health. The medical students in the School of Architecture, landscape architecture professors, or the medical school professors, landscape architecture professors, have been already publishing articles in top journals about how greenery in low-income areas reduces the incidence of cardiovascular disease amongst low-income Black population, Medicare population, elderly population. We're now coming in, again, with a couple of my students who are working on this project, to look at what does it cost to do these plantings and how does it in turn reduce the incidence of cardiovascular disease and how much cost savings and quality of life enhancement is affected by doing that. So that's just two examples of many projects I've been involved with over the years. That's fun stuff.
Awesome. Thank you both for sharing. Those are really interesting. So in turn, with the things that you have been working on and the things that you've shared, what do you think the future of health looks like? Or even what areas of health are expanding the most or that you see having the greatest growth?
I'll tell you what one of the greatest needs are, and that is population health. We have stats that just are really bizarre. We have the highest cost of healthcare in the world. We are also ranked very low in terms of outcomes of our healthcare system, in terms of things like infant mortality, length of life, quality of life. I use the example, I like my Starbucks coffee. I'm addicted to my Starbucks coffee. And the example I use is this. We have the most expensive cup of coffee in the world. Starbucks is the most expensive cup of coffee in the world. But you know what? Oh my God, that's good coffee. That is incredibly good coffee. I get value, very high value from that coffee. I do, maybe you don't, but I do. Okay. So even though it's the most expensive cup of coffee in the world, far more expensive, 3 times the cost of the one at McDonald's and other places, but the quality is awesome. Now, if I took that most expensive cup of coffee in the world, and I took a sip, oh my God, that's horrible coffee. That's terrible. I would have low value from that cup of coffee. I would not go back. That's not true in healthcare. Okay? We have the most expensive cup of coffee in the world, and it's one of the worst cups of coffee in the world. We are ranked 47th in life expectancy. We're ranked 57th in terms of infant mortality rates in the world, which is horrible. And these are the areas that we require attention on. Our infant mortality rates with all of our technology that Paola is working on, all of that technology, our infant mortality rates are not going down, they're going up. Our maternal mortality rates, women giving birth, the rate is not going down, it's going up. So our results are not getting better over time, they're getting worse over time. And these are some of the aspects that we're trying to figure out. We have the best technology in the world, but we have very poor outcomes associated with prevention in terms of what we do and population health. That's one of the major areas. The other major area, which is a worldwide phenomenon, except for Equatorial Africa, is the aging of our populations around the world. A major, major issue because we're not able to figure out how to sustain the growth of this elderly population and the constraints it puts on our healthcare systems.
Yeah, I have to echo what you just mentioned on the prevention kind of side for the healthcare. That's a huge issue. Right now, I feel like for all the healthcare providers, people who work in the healthcare space, we have realized that our system is very reactive. So every time that you get sick, you go to the physician. Probably you, your parents, your grandparents, you have seen it. So every time that one of you gets sick, you go to the physician. But the prevention side on like, let's exercise, let's eat healthy, let's have all of these kind of conditions that help be improving with your health are not very widely available. The knowledge is like very focus on one part, and there is no like translation on these things. So that's one aspect that I will echo from what Stephen mentioned. One thing that I've been seeing in my practice in the hospitals and as an innovator in this space is that we don't have enough clinicians, we don't have enough nurses, we don't have enough physical therapists. There is a great shortage of providers, healthcare providers, and that could happen for many reasons. But this is what we are facing right now. We have technologies that have been helping us with some things. I'm pretty sure that you are aware of AI and the use of AI in medicine. So that looks promising only for the things that have patterns recognition. For instance, radiology. The radiologists read a lot of images, and AI can help them kind of go and read them and sort of organize which one have priorities versus not. We are there. The different algorithms have been deployed and they have been used in the hospitals. But it's still, there's a couple years from now, because AI is statistics, right? Don't get confused by that. Just apply mathematics or apply statistics to something. That's the other thing. So yeah, I would say we need clinicians, we need nurses, we need physical therapists, we need people who really like to work in this area. And also, if you are going to work as an engineers or as a business people, I think what Steven's mentioned, working in multidisciplinary teams is key. I just learned that when I moved to the States. Unfortunately, in my country, there's only few opportunities for you to do that. So that's key, because you learn from everyone, and then you start applying that same knowledge in different projects over time. So if you can have that kind of a scope when you can learn from different places and just apply to the thing that you learn to your field, that's also neat.
Okay, there we go. Awesome, thank you for that. That actually goes quite well with the next question, Paolo, what you were talking about with multidisciplinary work that sort of needs to be done in order to sort of delve these fields out, or at least explore more. So I was going to ask, what roles do STEM professionals play in solving these problems that we're facing today? So I think it would be nice to hear more about how sort of those interdisciplinary opportunities aid in either more discoveries of things or solving the problems that we're facing, that and that this also goes towards Stephen as well. So what are y'all's opinions on that?
Well, just as an example of, again, an environmental issue, which has such a significant medical impact and healthcare cost impact, the example I used about the red tide, you have marine scientists, that's STEM. You had atmospheric scientists, that's STEM. We had biostatisticians working on the project, that's STEM. They had people like me doing healthcare cost analysis, that's STEM. So we would not be able to sort of tackle these kinds of issues without us understanding aspects of STEM. It just wouldn't work. Almost all the projects I've worked on over the many years are involved, if I'm not involved from a STEM perspective, and I'm all involved more from a more social or sociological aspect of it, there are people always on our teams that are STEM focused, and we basically are very reliant on STEM focused people. And so it really crosses across the whole different areas of healthcare. The realization is that the healthcare industry is almost 20% of the economy, and STEM plays a major area in terms of all of this huge aspect of our industry. And also going to what Paola said, also STEM is associated with the clinical part of it as well. As Paola mentioned, we're going to have a shortage of nurses. We are anticipated by the year 2030, which is only 6 years away, to be short over 800,000 nurses in this country, which is critical, which is a disaster on the going forward.
Yeah, it's a huge problem from the multidisciplinary kind of perspective. I feel like that's what it brings. It brings different perspectives. I feel like if you want to resolve a problem, you need to look at the problem from different point of views. And that's what multidisciplinary teams bring to the table. First and foremost is the analysis of the problem from different perspectives, because one problem could be a huge problem within medicine, but that problem could have already been solved in another industry. And that's why it's key to analyzing from different points of view. And the other part is like the treatment of that problem, or the solutions that you're gonna give it to that problem. Those solutions, again, could be implemented from the engineering side, or could be implemented from the medical side, or biologists. So that's what is key. In my work, I have always interacted with engineers, like since I moved into the States, with engineers. They are basically part of my team, and business people and people who are related with reimbursement. That is like how can we pay the healthcare system for what they are doing. But we always have these clinicians, engineers, and people with business background to solve problems within the medical space.
Give you one more example of that. I was just on a Zoom about an hour ago with one of our professors of healthcare process and process improvement. One of the areas that he works with is what's called continuous quality improvement, where you basically are looking at, an example would be how you're utilizing the operating rooms in a hospital system, and how to more efficiently and more effectively use those operating rooms, so you don't have people queuing up for weeks to get an operation. If you could use a surgical procedure, it could be more efficient in how you create those efficiencies in a operating theater, as they're called in hospital systems. You could therefore much more effectively enhance quality, reduce costs of surgical procedures. And he's a professor of engineering at the university, and focuses on the healthcare industry. Just one more example of STEM.
Awesome. Thank you both. So this week with RePicture, the topic has been personal branding. So have you in your careers thought about your personal brand? And if so, what would you say your personal brand is? And you can take a moment to think about that before answering if you need to.
Even if you want to go first.
I'm considered to be an international expert. Again, as mentioned, I've traveled the world at invitation by health organizations. I've done work in South Korea to create a healthcare city. I've worked in Germany with a large hospital system. I've done lecturing in Argentina and Brazil, in Colombia, Chile. We were working on a project in Mexico to try to enhance utilization and prevention of cardiovascular disease, taking a team of students down there, graduate students, to work on that. I think my branding has occurred just by people getting to know my work over the years, and know that I tend to work in an ethical manner, in a manner understanding different cultures and the nuances of different cultures, and the ability to interact with people in terms of creating a environment to basically solve problems to enhance population health around the world. So I have not advertised. A lot of it is word of mouth, but it's apparently become a global word of mouth in terms of what I've been working on.
Yeah,
Awesome,
I feel like I've been starting to think about that not until 2 years ago. That was something that nobody taught me. And I thought that I didn't need to sell myself when I was for works or for applications for universities. I don't know. I feel like you have been thought about this, but in my country, no one told me about it. And I think it's key. It's super important for everyone to know how to sell themselves and to have like a branding along with their name. In my experience, I think like my branding would be like I am a journalist, and that I could wear different hats depending on the situation. I always say that I speak not English and Spanish, but like different language in terms of like I can communicate very effectively with physicians. I can communicate very effectively with engineers, and same thing with the business background people. So I feel like that's my branding, like a generalist who can integrate everything and to bring innovation into this space.
Yeah, let me just, I might talk to you for a second, to
Sure.
people, from a very different perspective. I was the dean of the graduate school here at the University of Miami for 10 years. So I dealt with a lot of students around the country, because I would go around the country looking at appropriate students for graduate school, but also therefore interacting with lots of undergraduates. And also was involved in some special programs to enhance STEM education. I always told people that you are marketing yourself even when you don't know it, and you're unmarketing yourself even when you don't know it. So I've been at meetings with students that were going to occur a little bit later in the day, and I would be in the elevator with them, for example, going up floor. They wouldn't know who I was, even though I was going to be instrumental in a couple of hours in terms of what their careers might look like, including their academic careers. They didn't know who I was, and I knew I was going to probably be interacting with them. If they didn't make eye contact, if they didn't interact with me, if they were sort of into their own, own whatever they were doing, there was a realization they were losing the opportunity to already market themselves, to already brand themselves, as opposed to the student who would say, "Hi, I'm so-and-so. Where are you from?" And start having that initial interaction. That is how you start branding yourself right off the bat. I use an example. I run a big conference every year called the Business of Healthcare Conference. It draws over 1,000 people. And I had one of my students, I teach my students, or try to teach my students about this. I had one of my students come up and I was talking to the chief executive officer and president of a very large healthcare system here. And she came up and I introduced her to him, and she just started giving her little elevator speech. And he said, "I'd like you to call me on Monday." And he offered her a job, just because she already was branding herself in just that couple minute interaction. And that's where branding is something that goes on constantly. It's not something that is segmented, is part of your life in terms of interacting with people. It's your strength to be able to do that.
Awesome.
Yeah, and I would say like practice and practice and practice. I have like an elevator pitch for a minute. I can give it for 30 seconds. I could do it for 3 minutes, 5 minutes. So you need to read your audience and like where you are, who are you talking to. In the moment that you need to give your elevator pitch, you have like the short version, the medium version, or the long version, depending on what you need.
Yeah, awesome. Thank you both for sharing. Yeah. I think Stephen was sort of going into this a bit about sort of like a piece of advice for students when it comes to, this is more so towards personal branding. But if you both could give like one piece of advice, like a minute or less, of a piece of advice that you give the students here that you wish you had had at the beginning of your career. And if Paola could start for that one.
Sure. So I feel like I would tell myself, do not be afraid. During my career, I made a lot of pivots and changes in my professional way. The first one was to decide not to go to my clinical practice and not to be like a regular clinician and practice as a clinician. And in the moment when I was taking the decision, I was afraid because that's not what people do, right? I mean, when you do med school, that's the only thing that they teach you. What's your residency, what's your specialty, and then your fellowship. So going outside the box and just like changing that direction can cause a lot of anxiety. But at the same time, if that's what you feel you need to do, it's okay. So the second change that I made was like changing my country, right? I moved to the States when I was living in Colombia. And when I moved, that was 4 years and a half ago, I didn't speak English. I didn't know how to speak English. So I was afraid, and I was like, I'm going to Harvard to do research and I don't know how to speak English. This is going to be a disaster. But no, I feel like we are very resilient as a human beings. And I feel like if you have a goal in your mind, you can accomplish that. So I would put a fear. I mean, it's good to have fear sometimes, to scared sometimes on things, but I will tell myself just like, take it easy, everything is gonna work out, and you're doing a good job.
Yeah.
Awesome. Thank you.
Yeah, to piggyback on what Paula said, and differentiate yourself from everybody else. You need to stand out. And so that means having different experiences, internship opportunities, job opportunities, anything that you can put on your resume, being part of a club, being a leader of a club at school, college, whatever. All of these things stand out when you're putting your resume together one day. So say, here's how I'm different from other people. That becomes one of the aspects. The other aspect is to do what you have passion for. I tell people come to me, students will come to me and say, I'm interested in making money. And so shouldn't I go into, a field? And I said, do you enjoy that field? Well, I can make money. No, do you enjoy that? You will succeed if you have passion for what you're doing. You can go into a field that, quote, you can make money, but if you don't have passion for it, you don't like it, you don't excel, and you do not go anywhere. If you have passion, wherever that passion is, that is where you start excelling. That is where you start showing your abilities. And that's where your life expands professionally and personally. Always go with where your passion is.
Awesome. Thank you for sharing that. Definitely agree with both of those. Did that myself with switching from civil engineering and being a transportation planner. So that's like definitely leaning into your passions more so, and finding the things that you like and finding the people that you work well with even makes for a good time. So before I go into a few student questions, I wanted to ask one more general question. But how do students, or really anyone, find out more about careers in health?
You go, Steven.
Actually, I have a book. You go ahead, Paula. I'm going to get my book.
Okay, I feel like for me is go and talk to people. One thing is like what you see posted on those websites, and you can read the description of what the career is and like how does it look and what is the pensum or the that matters, of course, and that's important. But try to find people who are doing those careers, or the people who are working in those fields. They are the ones who are gonna tell you first and foremost what is the career, how does it look, what they are expecting, what they are looking at. And second, the people who have already graduated and are working on those fields, they can give you more perspective, like a broader perspective of what it is, for the opportunities, how do they feel. Do not get biased only with one person. Like try to talk with as much people as possible, because you don't know who is gonna give you that advice, right? I mean, if you talk to me, I'll be very optimistic. I love what I do, and that taps on the passion side that Steven was speaking to or talking to. But perhaps my coworker is not happy and they can give you like a biased thing. So try to increase your sample size and try to talk to as many people as you can, because they are the ones who truly are going to tell you what it is and how it looks, more so that what is described on the internet.
Yeah, and that includes your professors or your teachers. I mean, they know areas that they're working in, but they also know people who are working in other areas as well. Teachers, professors, they like to have students talk to them. Don't be afraid. I encourage my students constantly to come and talk to me, not just about the coursework, but where am I going in life? What would I seek out? How do I find out more about this? And really sort of utilize those resources. Plus, again, those are the people going to write letters of recommendation for you one day, as opposed to the person who sits in the back of the class and doesn't say anything, and it comes to you at the end of the semester saying, can you write a letter? And all I can say is, Jenny was in the back of the class and was a nice person, as opposed to being able to go into detail. There are many types of books like this. I'm going to show you two of them. This is 101, if I'm showing it backwards, right? 101 Careers in Healthcare Management. There's another one on 101 plus careers in public health. There are other books that are associated with these different fields of healthcare. They're cheap. They run about $30 on Amazon. You can probably find them in the library. And they really give you an insight of all these areas that people don't generally think about in healthcare. And so, because healthcare is such a huge area, so expansive, so many different parts to it. And so these kinds of books give you insights as well. Plus, you can go to different websites as well in terms of different aspects or different fields of healthcare. Most fields of healthcare have professional associations. And as a student, you can go and become a member for oftentimes zero, as opposed to the professionals that are paying $300-400 a year to be members. And so utilize your opportunity as a student to get access to the same information that those who are professionals pay huge amounts for.
And I like to add something. I don't know if this could be useful or not, but there is a book called Designing Your Life. It was written by like the D School's creators here at Stanford. It's very popular. Like the D School is the design school here at Stanford. And basically, it's a book where you have to do some exercises. And one of the exercises that you need to do is it's like a diary. So you need to start writing out what are the things that you would like to spend your time doing, and what are the things that you kind of like don't like spend your time doing those things. So it gives you like a score, and you will be like shocked with the result that you can get out of those exercises, because at the end of like the 3-week mark, yeah, exactly, that's the one. When you finish at the 3-week mark, then you go back and you review the results, and it's like, oh, I get a lot of energy and I feel like very passionate about when I'm doing X activities, and I feel very drained when I'm doing the other activities. So that kind of like speak about what's your passion and what you like, and those are like helps that you could use to find out what you like to do and what or not, if you don't have that clear in your mind yet.
Awesome. Thank you. Thank you. Thank you. So now I am going to shift into questions from the students. Let's see. I can start with one of the questions that Joanne wanted to ask. If you'd like to unmute, you can go ahead. And if not, I can ask it as well.
I don't have the question on me right now, so can you ask it?
Yeah. So Joanne noticed that you, so this is for Paola. Joanne noticed that you have held many research positions, and wanted to know if you could explain what research that you've done and what role that you've played in your research. And then in addition to that, what roles are available for students majoring in statistics?
Okay. So I don't know which ones are available for student major in statistics, but I can speak about like probably openings for that. But sure. So as Stephen was mentioned, I was one of the persons when I was doing med school that always was like talking to teachers and professors, and like I always had this curiosity on me on like, how can I improve things? How can I do things better? So I remember that I started doing research when I was on probably my 2nd year of med school. And I decided to join a research group that were working with epidemiologic kind of things in Colombia. So I was just like learning about like what were they doing, and my job at the beginning, since I didn't have any experience, was basically collect information. So I was a person who was sent to talk to the patient and collect the information and write everything down and make sure that all the notes were very well taken, and then take the information back to the statisticians or to my professors. So it was very on the field, but it wasn't, I mean, at that time, I thought that it was very research focused, and I was learning how to collect that information, how to put that information together, but giving that and handing that to my professors. Once I started getting more experience, they decided to start like, Paula, now you're gonna do the data analytics. So at that time, I didn't know how to work on Python or any of these programs are. So I was using Excel and Stata or SPSS. That those are kind of like softwares that we used at that time to analyze data. And I was doing the analysis, and the statistician was the one who was reviewing that I was doing a good job. And if I was doing a good job, then they started like giving more freedom to do the analysis. Then I started moving on from different positions. And then I was like, okay, what about if we do this research? And I came up with the questions. So that was the kind of like the evolution of my research career. And when I was at that point, like I was bringing questions, I was able to do the research by my own. So I started with very clinical research. When I moved to Boston, I started working as a fellow, research fellow in the Department of Neurosurgery and the ICU, that is intensive care unit. And I had like 10 projects under my supervision. And I feel like six or seven of them were very like clinical focused. So analyze data and put together the manuscript, and so in the manuscript, send it over to the journals. But 3 of them were very translational. And at the time, I didn't know what translational mean. I was like, how can I, if it is research, then the objective is to publish this on a journal, and that's it. By my boss at the time, that it was kind of my mentor. That's another key thing, like differentiate between bosses and mentors. And he was kind of my mentor, and he taught me how to take those research projects forward and to take what the findings that we were having on those research to the hands of the person or the people who will beneficiate the most. So then I started learning about like business and how to create startups and like all the things that those things encompasses. And then I decided that that was my passion, and that's why I started to do what I'm doing now. So those were like kind of my roles in doing research. And for a statistician, I feel like there are many positions open in like hospitals and groups that work with research. So I think like they're always constantly posting jobs in LinkedIn about like we need like a postdoctoral research assistant and a statistician for this department. So usually cardiology is one of the biggest departments who has a lot of resources in terms of funding, so they can pay for students who have like a major in statistics to do those kind of roles.
Awesome.
Huge demand for biostatisticians in academia, in government, in consulting, on think tanks, in pharmaceuticals. I mean, we cannot find enough biostatisticians. Huge demand.
Yeah, awesome. And actually this sort of the interdisciplinariness of all of these things. I have a question from Bethany. If you'd like to unmute, you can go ahead and ask. But before you do that, I think based on the time that we have, we'll probably have time for one more question, I think, from Alexa too. So if we could try to fit both of those in, let's try our best. We don't want to keep you all also past the time that you have allotted today as well. But thank you. Bethany, you could go ahead.
Yeah, I see that a commonality of both of our panelists is that you guys try to incorporate patient advocacy and trying to increase equality in the healthcare system. So I was wondering if you guys had any advice for someone who was also passionate about doing that, like combining economics or policies with working in healthcare.
I think Steven is the one, is the right one to answer that question.
Come and work with me. You do this by definition. There's so many aspects of what we do in terms of our work. And again, the opportunities are in government, in consulting, in think tanks, and in the academic and the academy and the universities to do this kind of work. This is part of our culture. This is part of what we do, period. So there's no shortage of the ability to work in these areas from different angles, from different aspects of what we're all working on. You've heard of some of my angles. I haven't told you my whole history because it's a long history. Worked on all kinds of projects that are dealing with these kinds of issues from different perspectives. Lots of opportunities.
I don't know if we've
You're
been muted.
My bad.
There you are.
There I am. Awesome. Could you repeat that again? I'm so sorry. The last part of what you were saying.
That I said, come and work
We
with
heard
me.
it, Jerry. It was,
Okay.
I think it was just muted for you. Sorry.
Okay.
Yeah.
Okay, no worries. Cool. So our next question from Alexa, if you're here.
Yeah, my question was about how do you keep up with the innovations in research and specifically in biomedical research, and if this really affects your own research?
Well, that's biomedical. It's your question.
Absolutely. I feel like, yeah, when you're working on a project, you are full time on that project. So you kind of like leave aside the other aspect of, for instance, let me give you an example. Probably this could be better. This year I'm working on balance in elderly, and that kind of taps on human performance. Last year I was working on cardiology. So last year I did nothing by reading about cardiology and how to improve heart failure in patients with heart failure. This year I'm not doing anything but reading about balance and just like going deep on those topics. Every time that I have a project, I'm learning from different diseases or different aspects, but I try not to go and read other things because it's just a full-time job doing what I'm doing. And yes, of course, it depends on what you do. So for me, I'm not publishing anymore, only small things. So I think like I have 2 projects on hold, but I'm tapping only on those because they're very important papers. But I had to make the decision of like, do I want to work on research purely, or do I want to work on translational research? If it is in translational research, unfortunately, there is no much publishing from my side, but I am the person who coordinates the team and who said like, okay, this is the need and this is how we're going to work. And if we have information that another person wants to publish on, I'm happy to give it that information for them to keep publishing. But I cannot lose track of the vision of the project that I have with the translational focus. If that makes sense.
Awesome. Thank you. We don't have that much time, but I was going to add one more question that I saw a student ask, and keep this to like 1 or 2 words if you can. But what is the favorite part of your job, just to end the panel today?
Teaching my students.
And I love everything that I do. I feel like that brings me happiness. So for me, working is not a work, actually.
Awesome. Awesome. Well, thank you all for being here for the panel. Thank you to our panelists, also for answering all of these questions. And I'll hand it back to Elisa.
Thank you, Jerry.
Thank you.
Yes, thank you, Jerry, for moderating our discussion, and Stephen and Paola for joining us today. So many amazing insights, I think, that our students will get to take away with them. And there were a lot of questions we didn't get to, but that just means that people are really interested in what you're doing. So I just want to highlight, like, some of the things you said are just very in line with things that we tell our students, to reach out to those professionals, connect with professionals, multiple professionals, like get a varied interest. So I hope in your personal brand, you have one, whether you realize it or not. These are things we'll talk about in class over and over again. So thank you for confirming the things that we're talking about as well, and for taking the time to come and share your insights and your passion with our students. We really appreciate your time. So.
Absolutely. Thank you for inviting us. And thank you, Stephen, for sharing the panel with me. And thank you all. Have a good day.
So okay, thanks. Bye, everyone. And we'll see all the students next Tuesday. Bye, everyone.